Here are exercises for knee osteoarthritis to aid walking ability. Welcome back to BHlth with Tess. My name is Tess Halbauer, physiotherapist. Joint pain and stiffness are common consequences of knee osteoarthritis, often impacting walking ability. Range of motion and strength exercises are one way to build and maintain knee joint movement and strength, which can aid walking speed and duration for those with knee osteoarthritis. By the end of this video, you are going to know how to complete 7 exercises for knee osteoarthritis to aid walking ability. This video is following on from the video Walking with Arthritis, linked in the description and at the end of this video.
Starting with quad activation, sitting on a mat with a towel rolled under your right knee. Squeeze your quadricep muscles at the top of your knee to press your knee into the towel. Repeat 8 times. As the name suggests, quad activation activates the quadricep muscles. The quadricep muscle group, along with the hamstring muscle group, are the 2 muscle groups that act to support and stabilize the knee joint. Each of these muscle groups contains 4 individual muscles which surround the knee joint to provide stability during movement, with the quadricep muscles around the front of the knee joint and the hamstring muscles around the back of the knee joint. Repeat with your left knee. Squeeze your quadricep muscles to press your knee into the towel. If you experience difficulty with straightening your knee, use a larger towel to allow more knee flexion. The aim of the exercise is to activate your quadricep muscles rather than straighten your knee completely. Quadricep activation is an important exercise to incorporate into a walking program for those with osteoarthritis. This is because knee pain can decrease voluntary and involuntary quadriceps activation, which can subsequently reduce the ability of the quadricep muscle to support the knee joint in activities such as walking. The second exercise is heel slides. Lying on a mat, slide your right heel along the mat to bring your heel toward your bottom. Slide away from your bottom to straighten your knee. Repeat 8 times. Heel slides aim to increase range of motion in both knee flexion or bending and knee extension or straightening. Additionally, along with quad activation, heel slides are a great warm-up exercise to complete prior to walking. Promote movement of the synovial fluid across the knee joint and to reduce some of the stiffness that may have developed from sitting or resting for a prolonged period of time. Repeat, sliding your heel along the mat to bend your knee. Slide away from your bottom to straighten your knee. Repeat with your left leg. Slide your left heel along the mat to bring your heel toward your bottom. Slide away from your bottom to straighten your knee. When completing heel slides, aim to reach your maximum range of motion in both flexion and extension. You may feel slight pressure or stiffness at the end of each movement, but should not feel sharp or sudden pain. If you do feel sharp or sudden pain, move within the range of motion that is pain-free before getting to the point of sharp or sudden pain. As knee osteoarthritis often impacts range of motion, it is okay if you are unable to reach full range of motion or completely straighten and bend your knee. There is a link in the description for more information on knee range of motion exercises for osteoarthritis. Repeat, slide your heel along the mat to bring your heel toward your bottom. Slide away from your bottom to straighten your knee. The third exercise is a bridge. Lying on the mat with your knees bent so your feet are flat on the ground, lift your bottom off the ground. Lower your bottom down. Repeat 8 times. The aim of glute bridges in this routine is primarily to build hamstring strength. Hamstring strength is particularly important during walking downhill or downstairs, as the hamstrings act to stabilize the knee joint during these movements. Weak or poorly activated hamstrings can result in increased strain being placed on the knee joint and knee joint ligaments during these activities. When completing a bridge, the aim is to lift your bottom off the ground. You may not be able to reach a full bridge right away. The fourth exercise is mini squats with dumbbells. Standing with your feet shoulder width apart, bend your knees to squat, aiming for roughly 45 degrees knee flexion. Repeat 8 times. Mini squats build strength in both the hamstring and quadricep muscle groups, as well as other muscle groups of the lower body such as the glutes and lower back. For this reason, mini squats are a great exercise to incorporate into a walking exercise program for any person to build lower body strength. The fifth exercise is a mini stiff leg deadlift with dumbbells. Standing with your feet at shoulder width apart, your knees slightly bent and your back straight, bend at your hips to lower the weight to just above knee height. Repeat 8 times. Stiff leg deadlifts primarily work the hamstring muscle group. Progressions of mini stiff leg deadlifts include full stiff leg deadlifts to bring the weight to below knee height. Repeat, keeping your back straight, bend at your hips to lower the weight to just above knee height. The sixth exercise is step ups. Standing in front of a step, step up with your right leg. Step down, again leading with your right leg. Repeat 8 times. Step ups work the lower body muscles including the hamstrings and quads, and also muscle groups of the ankle and hip which aid to support knee joint stability more indirectly by facilitating alignment of the knee joint and facilitating muscle activation patterns. Repeat, step up, leading with your right leg. Step down, again leading with your right leg. Repeat with your left leg. Step up, this time leading with your left leg. Step down, again leading with your left leg. Step ups are a great exercise to incorporate into a walking exercise program, as they incorporate the stepping movement involved in walking with the added benefit of upward stepping movement to further build strength. Progressions of step ups include stepping onto a higher step such as a block or weighted step ups holding onto a kettlebell or dumbbell. Repeat, leading with your left leg to step up. Step down, again leading with your left leg. The seventh exercise is side lunges. Standing with your legs shoulder width apart and your knees bent, step out to the side with your right leg, placing weight through your right leg as you step down. Repeat 8 times. Side lunges facilitate weight bearing through the knee in a controlled way, facilitate strength building in the coronal plane of movement, and facilitate balance, making them a great exercise to incorporate into a walking exercise program. Repeat, stepping out to the side with your right leg, placing weight through your right leg as you step down. Repeat with your left leg. Step out to the side with your left leg, placing the weight through your left leg as you step down. Join the Age Fit with Tess Facebook group to get further support managing pain, building strength and gaining fitness. If you have osteoarthritis and are unsure if you have the right exercise program put together, make sure to get your complimentary Age Fit with Tess self-assessment to identify if you're meeting 10 key components of a successful exercise program. Head to www.agefitwithtess.com to get your copy. Subscribe and ring the bell for more videos like this one, and to continue to manage pain, build strength and gain fitness in the meantime, watch these videos right here. See you next time.